Welcome. We will take a minute or two more and folks join us. Please mute yourself. This is a Zoom meeting. So as you join, just be sure to put yourself on mute. We will start in just a minute. Hello, and as you arrive, please change your Zoom name. So it says your name and your organization, similar to how I did it, for example, here. If you don't mind, it's good to have an idea of who all is in the room with us. Thank you. Hello to those joining us. The numbers keep going up, so folks are joining. Welcome. Please, as you join, be sure to mute yourself. You can turn your camera off for now and change your Zoom name, please. Your display on display to say your first and last name and then your organization, so we know who is with us here today. Thank you. We will start shortly. Hi, Emma. Emma said hi in the chat. Welcome, everybody. I think we are going to begin. My name is Elma, and I'm the coordinator of the Public Health Center of Excellence on Dementia Caregiving. We're very excited for today's session. It's the first in a series of virtual roundtables that we'll be introducing shortly. So we're thrilled that you've joined us. Just from looking at the names, we know many of you have attended our past webinars and events. Thank you for coming back. And to those of you for whom this is the first time, welcome. Nice to see you. Next slide, please, Maya. So as I mentioned, I'm the coordinator of the both PICO for short, Public Health Center of Excellence on Dementia Caregiving. And I also help coordinate the Center for Healthy Aging Innovation here at the University of Minnesota School of Public Health. Next slide. So just to ground us before we begin, we want to acknowledge, honor, and the land that we are on and its people, express gratitude to the land itself and the Dakota people, and honor their values, which we hope are embodied and represented in the work we do, which are courage, wisdom, respect, and generosity. Next slide. So as I mentioned, many of you already know our center, but for those of you who are joining us for the first time, the BOLD Public Health Center of Excellence on Dementia Caregiving, our mission is really to support and elevate the public health work in dementia, and specifically dementia caregiving. So it's to support public health agencies like you who are here joining us today in your, to advance and implement your dementia caregiving goals. We do that in three different ways. As a dissemination center, we disseminate evidence-based programs and interventions and best practices, help promote them. We are conveners, so we help facilitate connections and collaborations among public health and a wide range of partners who help advance their dementia caregiving goals. And finally, thanks to a robust membership of nationally known organizations in development and dissemination of dementia caregiving tools, we are able to provide technical assistance free of charge to all public health agencies, regardless of what their needs are and where they're at their with their dementia plan in their states. Next slide, please. So as I was mentioning earlier, welcome to this first session of this new virtual roundtable series. It will be a bi-monthly series, and it's intended primarily for public health. Not all of you here are representing public health agencies today, but everybody's welcome. And although most of the content will be relevant for public health, and many of the questions that today's speakers pose, and maybe even you, are going to be directed to public health. In each installment of the series, we will highlight the story of one state that has done good work and innovative partnerships in their state to advance dementia and dementia caregiving. And we are starting with Mississippi. It's an opportunity really to network for peer learning and an idea generation, to hear what others are doing around the country, to bring everybody to the same table, the same space, to share successes and learnings. And really, we would like you all to leave today with at least one idea for action, something that you can implement in your state. So we want to build a community of practice of public health, and we hope to start that today with this series. The next slide, Maya, please. So just a few reminders. This is a little bit different from the events that we've done in the past, which have been webinars. This is set up as a Zoom meeting. Hence, that's why we asked you to please mute yourselves and turn off your camera while our panelists are presenting. Please put your name and organization Zoom again, just so we can know who is here. And use the chat in Zoom to enter your questions as the speakers speak. Because after their presentation, we will have plenty of time for conversation to answer your questions and then for you to also exchange ideas. If you wish to answer a question, again, because this is a Zoom meeting space, please use the raise hand feature. Raise your hand. And only mute if we prompt you to. I will call your name, or one of us will call your name so you can speak when you have a question. And finally, chat is our communication networking space here as well. So use it for other questions, comments, and even to share resources and programs that your agency is doing as well that are relevant, pertinent to today's topics. And finally, the recording and the slides from today's session will be shared with all of the attendees. Welcome to those of you. I see a lot of new attendees, arrivals that are introducing themselves in the chat. Welcome. Please put your name and organization in Zoom, and we are going to start. Next slide, Maya. And I think at this time, Maya will help us. We would like to do a poll to get an idea of who all is in the room again, and see what agencies we have represented. Well, I think we are having some technical difficulties with the poll, so maybe we will skip that for now. If it works at some point, we will do it, but thank you for your patience. And here are our panelists. Today, you'll be hearing from two outstanding professionals in Mississippi, from Ms. Kina White. She's the director of the Office of Community Health Improvement at the Mississippi State Department of Health, and she also leads the Mississippi Bold Public Health Program. Denise Lafferty will be joining Kina today, and she's the Chief Strategy and Operations Officer at the Mind Center at the U of Mississippi Medical Center. Welcome both, and at this point, I will let you take us from here.
Awesome. Thank you so much, Elma, for the great introduction. Next slide. Elma, are you able to advance the slides?
Yes, we're going to do it in just a second.
Perfect. Well, while she's advancing the slides, on behalf of the Mississippi State Department of Health, thank you all so much for the opportunity to just join today. We hope that this is an interactive session. My colleague Denise and I, we have embedded some time for you all to also respond to some prompts that we have, because although we've had great successes, we've also had our share of challenges. And so we hope our peers can give us some ideas about ways that we can also strategize. So just a few of our objectives for today. I'll share an overview of our public health infrastructure and our BOLD capacity program. We'll also sort of give a past to present and what we'd like to accomplish in the future as it relates to our Alzheimer's and dementia work. We'll also share our collaborative impact efforts and how through our first 2 years of the BOLD program, we were able to accomplish quite a few successes and what we're hoping to do with our next level of funding, and then also engage with each of you in a roundtable discussion. So excited to be here again, and we'll get ready to get started. Next slide. So our public health structure in Mississippi is a centralized governance structure. And why that is important is because in our state, our local health department units are not autonomous. And therefore, everything that happens at our local unit is handled through our central office. And so we have to be a little more innovative at times when we're really trying to strategize and implement at a local level, because everything happens from our central area. We in Mississippi are also facing, as it relates to our public health infrastructure, a lot of challenges with smaller facilities in our rural communities closing. And so our public health department having to really transition and provide additional resources at a community level. And so this is an ideal time for Mississippi to really take a step back and strategize what resources we'll actually have to address the needs of dementia caregivers, family caregivers, and those in the Alzheimer's disease and related dementia space. We do have 3 public health regions that we traditionally work within. The central area is where I am located, as well as Denise and the Mind Center. But we do cover the entire state in terms of support. And we have a very significant rural presence in our state. 16% or greater of our population are considered 65 and older. But when we really look at populace across our entire state, we have older adults in every county of our state. And so Alzheimer's disease and related dementia, although prevalence is higher in certain counties, we see a significant need for this work and support across our state. And so as we work to implement our BOLD program, I'll share some ways in which having a centralized structure has impacted how we do our work, and then also how we collaborate with other entities to accomplish some of our same goals. Next slide. So for those of you who may not be familiar, the CDC BOLD Public Health Program provides a unique opportunity for public health to really look at those systems, change policy, environmental strategies, but really focusing on risk reduction, early diagnoses, prevention of comorbidities, and avoidable hospitalizations. And what we're most excited about is that it actually gives an opportunity to really support our caregivers. We have seen throughout a lot of our work that caregivers have such an inherent need for assistance, whether it's providing them support as they continue to work, or for those who may have to step away from employment, providing them with an environment to really provide the support needed for their loved one. I myself was a caregiver for the past 2.5 years before I lost my mother. So I now have a greater appreciation for what it takes and what is necessary for those individuals. In Mississippi, we were fortunate to be one of the inaugural states to receive the funding in 2020. So we have had our program for 2 years now, entering our 3rd year. We have worked very closely with our centers of excellence, including the University of Minnesota today, just to really understand what are the best practice approaches for working on Alzheimer's disease and related dementia. But just to note, in public health, we often focus on the upstream approach. So not waiting until someone has a disease of response, but really trying to prevent that from occurring. And in Mississippi, it has been a challenge. We conducted a stakeholder analysis in 2015 in our state to ask a simple question. Do our public health colleagues consider brain health to be a public health issue? Overwhelmingly, the answer was no. So we knew, receiving the BOLD program, that from a public health approach, we had a little bit of work to do to not only change mindsets, but to increase awareness and education. And since we've had our funding, that's been a key goal for our state. Next slide. So as you can see, and most of you are very familiar with this slide, but we were again one of the initial states to receive core level funding. And just as a reminder for those who may be unfamiliar, the two various levels, core and enhanced, were really based on capacity. So the core level grantees either did not have a state plan, or they needed to enhance their state plan and make it more robust, associated with the Healthy Brain Initiative roadmap. And then also establishing a diverse amount of stakeholders and coalitions. And so in Mississippi, we already had an Alzheimer's state plan, and we already had an active body of leaders that we call a coalition, but we did not have a very strong public health approach to a lot of the work. Public health was not very involved in the development of some of the work. We were present, but not necessarily from a steering committee perspective. And so Mississippi was successful in receiving core level funding. And as many other bold grantees, we are really excited to apply for a next level of funding when that opportunity presents itself. Next slide. So our priority areas, similar to others, are really making Alzheimer's an urgent public health issue. We have been able to establish a lot of capacity within our agency and really raise the value of early detection and risk reduction. Throughout today, we'll ask each of you a couple of questions, but one question that often comes to mind in Mississippi, based on our challenges, is that if we increase early detection and we increase assessing for risk, and yet we have a limited workforce that is available to respond to those increased assessments, what do we do? And so that is definitely something that we have been challenged with, giving our workforce shortages and our level of prioritization. But we are very committed to ensuring that early detection and risk reduction become a key component of our work in our state. Preventable hospitalizations, we often see, even with our behavioral risk factor surveillance survey, that a lot of our Mississippians, as other states, have comorbid conditions. So in addition to a diagnosis of Alzheimer's disease and dementia, they may also have heart disease, they may also have diabetes. So having a more person-centered approach and really looking at how we can help address these other conditions would also help from having these individuals present to the hospital. Care planning and management is something that we're definitely focused on. And we'll share later an opportunity where we had a continuing medical education event and how we were able to embed that within our work. And then lastly, supporting caregivers. Again, caregivers are a key component of our work, and we'll share some examples of how we've had great success in really implementing innovative approaches to supporting our caregivers here in our state. Again, just a reminder, we do in Mississippi have a number of rural populations, and so health inequities and disparities is something that's embedded within and not separate from the work that we do. And that's very intentional, because we do understand that oftentimes Mississippi is ranked last in almost every health category. And so we knew we had a challenge on our hands, but we have a very dedicated team. And so we have some unique ways that we've been able to address health disparities and inequities, but also create a communication channel to hear from others within our community for what needs we may need in the future. Next slide. So now I'll turn it over to my colleague. One of the things that we often highlight in Mississippi is that prior to the BOLT program, there was a wealth of information, there was a wealth of capacity building, and there was a wealth of knowledge already in our state. A number of policies have been passed, a number of efforts have been conducted. And so when we received the BOLT program, it was really to bolster some of the great work that had already taken place in our state. So now I'll let my colleague Denise share sort of a history and timeline of where we started, and then I'll pick back up and share where we are now. So Denise.
Thank you, Kina. And I am so excited to be here as well. And we are thrilled to be the first state represented in this new Roundtable series. I wanted to give you just a brief history about the Alzheimer's state planning efforts here in Mississippi and where we are today. And then later on in the presentation, we'll get into some of our future plans to enhance and strengthen our Alzheimer's state plan. So legislation was initially passed here in Mississippi in 1998, charging the Department of Mental Health with developing an Alzheimer's state plan. And at that time, the Department of Mental Health established the Division of Alzheimer's Disease and Other Dementia. And I actually see that a member of that team is on this meeting. So we're excited to have her. After that, plans were put into place to really improve caregiver support services in Mississippi for loved ones of those with Alzheimer's and dementia. And also education and training programs were implemented. And there was a focus on ensuring that certain services such as respite care and adult daycare services were available to support caregivers in Mississippi. Also during that time, there was a great deal of planning going on, operational plans were developed, and then also there were initial meetings to begin planning for the development of a more formalized Alzheimer's state plan. So I came to Mississippi from Pennsylvania in 2013 and joined the Mind Center. And at that time, we became involved in the Alzheimer's state planning efforts, along with the Department of Mental Health, Division of Alzheimer's, and the Alzheimer's Association Mississippi chapter was also very, very involved in the early state planning effort. And so we worked together. We became the steering committee or the core organizations to help to move the development of the state plan forward. Of course, I will show you that we did recruit a lot of help in making that happen and a lot of contributors and stakeholders to the Alzheimer's state plan. So our initial state plan was released in December of 2014 and covered the period from 2015 to 2020. And then in 2019, we began to work on a revision of the current state plan. And in January of 2020, we released the 2020 to 2025 state plan, which we are still working to implement and making great progress. As Keena mentioned earlier, MSDH received the Bold Core Capacity Grant in August of 2020, and we have been partnering with the Department of Health for the past 2 years. And I'm really thrilled to be working with the Department of Health and with Dr. White and her team. So next slide. I just wanted to show you our initial state plan, which is featured on your left, and then also our current state plan, which is featured on your right. This is a 30-page document. It's a living and breathing document, kind of like a well-worn Bible. And we reference it all the time. And you'll notice also that we have developed a brand for our state plan so that it is recognizable in the community. And Keena's going to talk a little bit more about that going forward. Next slide. A little bit of information about the structure of our state planning efforts. When we started to work on the state plan, we did establish 5 goal groups, as we call them, to focus on the following areas: research, community awareness, coordinated care, caregiver support, and brain health. And these were modeled after some of the key focuses of the National Alzheimer's Plan and wanting to model the work of that group. We also identified a leader or 2 co-leaders for each of the goal groups. And early on, we recruited more than 40 volunteer contributors from the public and private sector who became members of these goal groups. We now have more than 65 volunteer contributors or stakeholders who are involved in the implementation and advancement of the state plan. So we've really grown tremendously. Next slide. I wanted to share this slide depicting all of our collaborators and stakeholders. And this represents the organizations, the industries, and the individuals who are involved in our state planning efforts. You'll see that our Bold Public Health Program and Alzheimer's State Plan is in the middle. And then the hexagons that you see in the deeper blue are the core organizations or the organizations that make up the steering committee of our Alzheimer's State Plan. So it's the Mind Center here at UMMC, the Mississippi Department of Mental Health, the Alzheimer's Association Mississippi chapter, and the Mississippi State Department of Health. And then you'll see some of the other organizations that are involved. We have a number of other state agencies involved. For instance, the Mississippi Department of Human Services. We have the Mississippi Division of Medicaid. We have some organizations that are involved in promoting health and specifically brain health in our state, such as the American Heart Association. We have an organization called Partnership for a Healthy Mississippi. And then we have others who are involved in the care and support of those living with Alzheimer's and dementia, geriatricians, social workers. We have leaders of caregiver support groups in our state. So it's really a wide diversity of constituents who are involved in our state planning efforts. As they say, it takes a village. Despite that, despite having a lot of diversity, we are always looking to add representation from various entities in our state who are involved in supporting and caring for older adults and those living with Alzheimer's and dementia. Next slide. I wanted to talk briefly about some of our recruitment and retention best practices. We have had new members join continuously once we started the Alzheimer's State Plan. And so a few things that we've identified that has helped us to retain our goal group members. So first of all, we talk about our Alzheimer's State Plan at state and local events whenever and wherever we can to keep it on everyone's minds. We invite new members to join and to get involved with a goal group that matches their area of interest or their area of passion. We schedule our goal group meetings well in advance and make sure we send reminders. And we are currently meeting on a quarterly basis. During the years when we were actively working to either develop or revise our Alzheimer's State Plan, we were meeting on a bi-monthly basis so that we could keep all of our initiatives moving forward as we work to identify what changes we wanted or needed to make to the state plan. We do solicit input from the members during meetings to ensure that their voices are heard. And when there's a special project that is being implemented by a goal group, we will at times also develop a subcommittee of members from that goal group to work on a specific project. We communicate with members individually between the meetings to help to keep them engaged. Email is good, but we have learned that picking up the phone and having a direct conversation is even better. We like to celebrate the accomplishments of the group and clearly communicate the future goals and objectives. And one of the ways that we do this is that we have an annual state planning summit. And Keena's going to talk a little bit more about this, but that is a way for us to review the accomplishments of each of the goal groups and clearly communicate the future goals and objectives. We do assess our membership complement to ensure diversity and inclusion, and we reach out to members who have not attended recent meetings to work to re-engage them, or we invite them to bow out if they're unable to be actively involved, so that we have active members who are part of each of the goal groups. Next slide. Okay, at this time, we would like to hear from all of you. You saw the organizations that we have involved in our state planning efforts. We would love to hear about some other organizations that you have involved in Alzheimer's state planning efforts in your state. If you could write your answer in the chat, that would be greatly appreciated, and we'll give you a moment to do that.
And while everyone is writing their answers in the chat, I see that Michael had a question, Denise. Do we have people with dementia as a part of our goal groups or goal leaders or stakeholders?
We have had people with dementia in the past. We do not currently have someone who is living with dementia, and that's definitely a goal as we look to add new members to our state planning efforts. We are also looking to add more community-based or business representation going forward. That's an excellent question, and it definitely is beneficial to have that input from someone who is living with a disease. Okay, if anyone has some feedback about what other organizations you have involved in your state planning efforts in your state, please write that into the chat. Culture change coalitions. Interesting. Anybody else? State legislators. Yes, that's an excellent recommendation. And that is one of our goals also that that was brought to our attention through one of our assessments that we recently did. Thank you. Well, we can go on, but if you have other organizations, please do go ahead and write them into the chat. Oh, thank you. Louise wrote quite a few. Thank you very much. We appreciate that input. And I will, I believe, turn it back over to Dr. White at this time. Next slide.
Sure. So one of the thank you all so much for the feedback as it relates to your diverse partners as you're building your state plan or working on your state plan. We recognize that, again, prior to the BOLT work, there was a select group of individuals volunteering to do this work. And with the BOLT funding, we did reach a new audience of public health leaders who wanted to be engaged in this effort. And as we continue to grow in our efforts, one of the areas that we did identify was definitely legislative support. And we'll share some examples of how legislators have been actively involved in our efforts. If not on the coalition full time, they've still provided a lot of support. But one of the things that we recognized prior to receiving our BOLT funding and then once receiving it is that we really needed to have a better way of utilizing data to inform our efforts. One of the things that we heard when we received our funding from the health department was that there was limited amount of information going out into the community. So our state health department houses a wealth of information, but prior to the BOLT funding for Alzheimer's disease and related dementias, there was not a direct program that was charged with sharing that information. And so we were very fortunate once we received our funding to speak to our state behavioral risk factor surveillance coordinator. And she was incredibly excited for the first time to be asked to do a trend analysis of data that we had collected over the years and share that with our key stakeholders. And so that was one of the first things that we did in our state. We implemented or included the optional module for cognitive decline every odd year since 2015. And so the 2015, 2017, and 2019 data had really been sitting on a shelf. There was no audience to receive the information. And so we collaborated with that team, and she was able to put together a trend analysis and share with our stakeholders at our annual summit the responses, what information we could glean from it, the demographic profile of those who responded, how many were actually talking to their healthcare provider. And then also in 2015, we included the caregiver module. And so we were able to assess response from that as well and look at our diverse demographic population. We were surprised at the number of male respondents under the caregiver module and what unique needs they had from that survey. And then this, in 2021, Mississippi also included the caregiver module in our optional survey. So we'll be excited to analyze those findings as well and see what updates we have. But we knew that we really needed to have a way to assess and measure based on sound practice and evidence what we needed to update or change. And so in addition to looking at our BRFSS data, we also collaborate with our BOLT Centers of Excellence, working with the team here today, University of Minnesota, looking at dementia caregiving statistics, also working with the Alzheimer's Association, looking at risk reduction information, and just really having a better understanding of what we needed to do to progress in our work. Another key partner that we were able to collaborate with very early on is the Us Against Alzheimer's organization. They have a dashboard or a data suppository entitled the NADEX system. And that system allows you to look at census tract data targeted specifically towards the African American and Hispanic population. And so when we launched our first Brain Health and Equity Symposium, we were able to look at the county level at a couple of counties in our state and really see prevalence related to Alzheimer's disease for those counties. And it was very informative because we were able to speak directly to that community and share what we had seen. Another way that we are utilizing data to really understand our efforts is we actually implement or release a state plan survey. So prior to the BOLT funding, that survey had been administered in 2014 and 2019. We administered another state plan survey this year in 2022. We added a couple of demographic questions because we wanted to better understand who was responding to the survey, but also because as a part of our BOLT funding, we were enhancing our existing state plan. We wanted to better understand what changes we needed to make based on some of the roadmap actions that we had reviewed, but also to make sure, as Denise shared, it is a living, breathing document. We wanted to make sure that we were still encompassing those elements and priorities important to this work. We also conducted a Healthy Brain Initiative roadmap assessment. And for those of you familiar with the Healthy Brain Initiative roadmap that was developed by the Alzheimer's Association and CDC, there's a section within the roadmap where there are specific questions tied just for public health leaders. And so we took those elements and we compared them to our state plan to see how close we were in terms of alignment, to make sure that we were capturing the necessary information and priorities. And we were really excited to see that, yes, our state plan did include a lot of those key elements within the roadmap action for public health action. One area that we did notice is that our goals were not SMART goals, and so they weren't very measurable. And that's something that we are working to enhance now to ensure that not only do we have a broad level of goals, priorities, and objectives, but we can also measure our progress of success. We've achieved quite a bit within our state. And we want to make sure that we can show that, so that if we're petitioning for funding, if we're petitioning for collaboration, we have evidence to support that. We've also conducted a research environmental scan, looking at various information out there, whether it's secondary research. I'll also share a special social determinants of health project that we've conducted that was really exciting for the work that we've been doing. And then also we did a scan for our comprehensive outpatient dementia care centers. We needed to know where they were and who we can contact for that network of support. On a previous session with some other peers, and some of them may be on this call, we learned that for states that have a similar workforce shortage like Mississippi, they've established dementia networks across the state working with various professionals so that we can ensure there's a catchment area for all populations who need it. And so as a part 2 to our comprehensive dementia care center scan, we are actually looking to identify innovative ways that we can create a solid dementia network in our state, so that anyone who is at risk or is being assessed or screened will have a provider that they can go to, a culturally competent provider that they can go to and feel comfortable speaking to about their needs. So we are really intentional about utilizing our data and making sure that the data we utilize not only informs our state plan, but also informs those efforts with our clinical providers, with our community partners, and just really has timely information available so that we know how many individuals in our state we're supporting. Next slide. So for you all, what additional, so I shared a few that we've been using across the last 2 years to really help improve our efforts. And so we wanted to hear from you all. What additional data sources have you used outside of the CDC Healthy Aging Portal or BRFSS or some of your local community health needs assessments? What other resources have you all used to really answer some of your questions related to Alzheimer's state plan efforts? So if you can put those in the chat, that would be great. And I see Kim shared a few resources as well about her coalition. So great. Thank you for sharing that for Georgia. Georgia is an enhanced funded state, so excited to always share for them. But are there other data sources that you all have utilized to help? And then a secondary question, if there are not, is there data missing that we would like to have access to that is not currently available to support state planning efforts? I will say for Mississippi, having county level data is always a challenge, really looking at the county level. And we understand the limitations with such, but great. So Louise said primarily perfect. So Alzheimer's Association, absolutely. Didn't include it as a specific data source, but we absolutely use that information. The facts and figures report is very helpful. And the other report is the race, ethnicity, the diversity report that recently came out. That's another excellent resource that we've also utilized for a lot of our diversity, equity, and inclusion efforts as well. Perfect. And if you have other data resources that you use, feel free to share them in the chat. And if there are data resources that you'd like to use that may not currently be available, share that too, because we want this to be a learning opportunity for all of us. And then maybe we can find ways to pull some of that data. Perfect. California Department of Health also has a report that they utilize. Excellent. Perfect. Thank you all so much. Next slide. So now I'll share how our program is basically structured and some of the components. Denise shared a few, but brand design was very important for our work. We wanted to be able to stand out as a coalition, as an organization, as a collective body addressing this work, so that if anyone wanted to know where they could find information or support, they would know what this entity looks like. So the graphic on your screen is a copy of our 2022 progress report. If you look on the second image at the very bottom, you'll see the logos for all of the key steering committee entities. And at the top, you'll see the same graphic that was used on our strategic plan. So we've been very intentional in using the same cadence of design, so that all of our efforts are very recognizable to our key partners and our community partners. It's on the far right of the first graphic, you'll see taking action. That's sort of a historical timeline of the work that we've been doing prior to the BOLD program, with the BOLD program, and then again, we'll continue to add as we make new achievements. One of the reasons we include this, and I think it's so important, is sometimes we do forget the progress that has been made when you're in the thrust of various challenges. So it allows our group, our team, to really see such great action that has taken place over the years and sort of where we're headed. Again, Denise shared, we do have very consistent meeting schedules, agendas, and minutes. That's very intentional. We have often learned that having very sporadic meetings is not very effective. So we do have our quarterly leader meetings. We do have our quarterly goal group meetings. If we need to have an ad hoc meeting, we will also do so. But we limit those because we typically will engage one-on-one or have smaller discussions offline. But if there are times where there are specific topics of discussion or things that are just very timely, we will pull our group together. Denise shared, we do have an annual state planning summit. This summit was established again as a part of the development of our state plan. With the BOLD funding, what we now do at our summits is I present every year on our progress, on opportunities for additional capacity to financially support the various goal groups. And so they sort of give a preview of what they would like to accomplish in the upcoming year, but also give a progress report and highlight some of the great accomplishments from the previous year. And so this has been a great way to understand the impact of our work, but also help to forecast what needs to happen next. We also have a dedicated team that participates in our annual State Advocacy Day at the Capitol. For some of you, you mentioned that legislators are a part of your effort, and we have them as well, but more indirectly as opposed to directly involved with the group. But we do have a State Advocacy Day where we really provide that support. And then an annual progress report, just to really capture what has been happening and really document our efforts along the way, because we find not just for funding, but just for a historical perspective, we think it's important to ensure that we document those successes. So as a program, there are two, I guess, windows of our work. From a public health perspective, the BOLD program has its leadership capacity and involvement. But again, when we received our funding, we conducted an internal and an external scan. And we identified that rather than starting an entirely new coalition, it was so much more beneficial to join the existing body. And so I contacted Denise at the Mind Center and a few others. We had a few conversations, and we've now become an amazing collective body of leaders really dedicated to improving this work. And so that has been a unique way that we eliminated the need to just start over, but really respect what has already occurred and just bring some additional capacity to the table, specifically with the public health approach. So that has been a great opportunity for our state. Next slide. And so now Denise will share some of our legislative support that we've frequently been talking about. So those of you sort of get a better picture of where we do have legislative support.
Thank you. And I would like to say that we embraced having the Mississippi State Department of Health join the state planning efforts. And that partnership has really strengthened the work that we're doing. And from the beginning, we have sought to ensure that our state legislature was aware of the Alzheimer's state plan and our state planning efforts. And so each legislator has received a copy of each of the state plans, and also each year, as part of the Advocacy Day at the Capitol, we do share a copy of the progress report with each and every legislator, and also our congressional delegates as well. So that has helped to raise awareness about it. In addition to extensive federal funding from the NIH, the Mind Center has received state legislative support for our research and clinical care. And this has been provided since 2014. So we are very fortunate to have that type of state legislative support of the research that's going on here at the Mind Center. Some of the recent activities related to state legislative support include State Senator John Horn presented as part of our second annual Brain Health Inequities Symposium. He has been affected by dementia in his family and was able to share a lot of information about his experience as a family caregiver and what their family experienced through that process. Also, in 2021, the Jimmy Kagler Alzheimer's Support Act was passed. This was named after a captain in the Air Force who also went on to serve as president and CEO of a hospital on the Gulf Coast in Mississippi, and who was very beloved, who developed dementia. And sadly, he did pass away in 2020, but this bill was named after him and to honor his family as well, who provided support to him. And so this Support Act established a pilot program within the Department of Human Services called the Mississippi Dementia Care Program. And once federal funding is received, it will provide respite care to informal or family caregivers of persons with Alzheimer's disease or related dementias. And so the Department of Human Services is in the process of starting this pilot program, and we will be supporting them in that effort. And I know that the respite care program will be very beneficial to our Mind Center Clinic patients and their families. Next slide. I'm going to talk a little bit about some of our plans for enhancements to our current state plan. So the current state plan runs from 2020 to 2025. And so these enhancements we will look to make during the period of 2023 to 2025. And Dr. White mentioned earlier that we had conducted a Healthy Brain Initiative Roadmap assessment several months ago. And that was to evaluate how our current Alzheimer's state plan aligns with the goals and priorities of the HBI roadmap. And we found that it did align very well. There are a few areas that we are looking to focus on. One is to ensure that we address prevention of abuse, neglect, and exploitation of people with dementia. The second area is to increase the training that we provide for public health professionals and also our policymakers. And third, we want to ensure that we are continuously evaluating the training programs and the caregiver support programs that we are delivering so that we can implement continuous improvement with those programs. And I will now turn it over to Dr. White.
Sure. So in addition to our roadmap assessment, we did establish a health equity ambassador program. So Denise shared that we have 5 goal groups. And so for each of those, we identified one volunteer who was willing to serve as the ambassador. And through that, we, as the BOLD program, we provide them with trainings on various topics: cultural competency, implicit bias, social determinants of health, just a number of topics that really allow us to engage within each of those goal groups. And I'll give you a great example. So for brain health goal group, we are working on messaging and wanting to ensure that the messaging we share as it relates to Alzheimer's disease and dementia includes culturally competent messaging for various diverse populations in our state. And so that ambassador is being challenged with learning more about exactly what that would look like in our state. We actually have a Vietnamese population on the coast in Mississippi, so ensuring that information that we share is competent for all diverse populations. I'm so really excited to bring that innovative approach to doing this work. And again, these ambassadors are all volunteers. They either are retired or have full-time employment, but they're committed to really looking at diversity, equity, inclusion, and belonging for our work. And so they have graciously volunteered to do this, and we're very, very thrilled to have them. We also have a collaborative project with the Mind Center. One of the clinical researchers, Dr. Butler, he is very interested in understanding how social determinants of health impact those with Alzheimer's disease and related dementias. And although we know the BOLD project and the cooperative agreement is not a research cooperative agreement, we were able to conduct an analytical review of existing research to really better understand what are the most impactful social determinants for individuals within our state. Is it access to care? Is it transportation? Is it health literacy? And so that is a project that we were able to, I would say, complete a phase 1 in this year. And then we will definitely have a phase 2 in year 3. And phase 3 is actually shaping up to be phase 2 is shaping up to be pretty exciting in year 3, because we had an individual present, or at least recommend to me, that Mississippi has a strong agricultural community. And just really thinking about those populations that may be underrepresented and how many of them are impacted by Alzheimer's disease and related dementias, and how that impacts those determinants, whether it's the rural community, the agricultural community, et cetera. So we're excited to delve into a little more geographical specificity in our next year of the report, to just really better understand in Mississippi, what do we need to change and what capacity do we need to have on this work. So really excited to see that project take shape for the phase 2 in year 3. Next slide. So here are some of the ways in which we have been working collaboratively together in our state through our steering committee and a lot of our partners. So our caregiver conferences, we collaborate with the Alzheimer's Association to host caregiver conferences. Actually, right now, today is day 2 of one of our virtual caregiver conferences with our Alzheimer's Association chapter. And so yesterday, I had the privilege of speaking in day 1 about the efforts we've made with the BOLD program, but also sharing where we'd like to head in terms of support for family caregivers. We also collaborate on a Purple Sunday initiative, which is where the Alzheimer's Association provides education and awareness on the 10 warning signs and other ways that our faith-based community can be involved in this work. And then we're also exploring the opportunities to collaborate and look at the ALTER program as well with Georgia State. So that is something on our radar as well. We've hosted a number of virtual continuing education webinars on various topics that really speak more to like our nurses and our social workers and others, so that they can continue to be provided professional development opportunities for this work. And also continuing medical education. For the first time, we were able to host an in-person continuing medical education event. And it was an eye-opener to see the number of providers that were present and really engaged in the discussion. And one of the things that was shared was the care billing, the cognitive care billing work through our Division of Geriatrics. And following that presentation and talking about the EPIC template that was established to make it easier to do that part of the visit, the Division of Internal Medicine reached out and said they were interested in also learning more. So it's always great to have other providers interested in collaborating to do this work. And then we're hoping in year 3, we can host another continuing medical education event and focus on transitions of care. So we have learned from a number of individuals that transitions of care as it relates to Alzheimer's disease is an important topic of discussion. And so we'll have a lot of focus on that in year 3. We also disseminate Mind Minute newsletters, at least quarterly. And those newsletters, again, have timely topics, whether it's brain health, heart health connection, when the new medications were passed to treat Alzheimer's disease and FDA approved. We had a newsletter about that as well. So again, just multiple ways of communication and innovation to our key stakeholders. As Denise shared, we have had a Brain Health Inequity Symposium for 2 years, and we're hoping and planning to have a third. Again, we usually host our Brain Health Inequity Symposium during Brain Health Awareness Week in March. And so that's a unique virtual opportunity where we invite key diverse leaders to speak and just really better understand what are the needs and what are the inequities in our state. And we have had great attendance with the Inequity Symposium. We've had well over 200 participate, and so at least at one time. So the second year we had a great attendance, and we're hoping to increase that even more in year 3. I shared about the Health Equity Ambassadors program and how we have them involved in the work that we're doing. Denise and I both shared about the scans that we conduct, and this is a very fluid process. I think for each of you, we understand that what we explore today may change tomorrow. So we're constantly looking and scanning to see what resources are still available. COVID was a great example of resources that may have existed prior to COVID. Post-COVID, they may no longer exist. So we're constantly scanning and assessing to ensure that we are prioritizing and strategizing according to national plans, local plans, and a lot of our assessments. We also developed a state agency reference guide for older adults. This is a unique tool. So on our collaborators map, we show the number of state agencies that were involved. But one thing that we often know is that most individuals may not be aware of everything that is available. And so with our team, they were able to put together a state agency reference guide so that local individuals would know what resources are available at the state level. We do have a Mississippi Access to Care network that works with all of our local area agencies on aging and our planning and development districts. That's a hub where older adults can contact one number and find a wealth of information, but we also know specific to Alzheimer's disease and related dementias, there may be additional questions and information. So that state agency reference guide was developed. We are in the process of developing a caregiver map. That map will also provide at a local level opportunity for family caregivers or even providers, anyone that would find benefit to the caregiver map to where they could identify resources, whether it's legal services, a dementia care center, just any place where they would be able to have an active resource. One scan that I have not mentioned yet, but I do want to just share, we actually did a scan of our area agencies on aging. We know that our AAAs are a key resource in our state, and not all of them are equally involved in this work. And so we wanted to see what capacity they had to be more present and at the table for this work. So in year 3, we've identified a couple of AAAs who are going to do some special projects related to Alzheimer's disease and related dementias. So that's another scan that we conducted so that we can make sure we have the right partners at the table. And I did share our social determinant of health analysis project and how we're really excited to look at next level and more specific pockets of determinants within our state and have our ambassadors help to address some of those determinants. So as you can see, through the BOLD work, we've been able to really leverage those resources, partner with our stakeholders and our shareholders, and just really involve as many as possible to understanding this work. It has been a pleasure working with our stakeholders, and most are really surprised when we say how well we work together. Public health is very separate from our state unit on aging, and we do a lot of great work together. So just really excited about that. Next slide. And so where are we headed next with a lot of our collaboration? We are launching a few awareness campaigns. Some of you may be familiar with the Know Where Alzheimer's Hides campaign. We have launched that campaign here in Mississippi. We started in August. And so we have a digital print social media campaign that's running. And then in year 3, we're going to launch a Brain Health is Public Health campaign so that we can make that connection between those upstream approaches to early detection and risk reduction for brain health. We will continue to increase our engagement of diverse stakeholders. Denise shared that we are looking to add some additional individuals to our group. We are also looking for individuals that may suffer with dementia so that we can have personal perspective to a lot of our strategic planning. One of the things that we are going to do in year 3 is conduct a virtual dementia tour. And for those of you who may not be familiar with that, through Second Wind Dreams, there is something called a virtual dementia tour. And that, hi, Melora. And so the virtual dementia Dementia tool will just provide a unique perspective for targeted individuals so that they can have a better understanding of what it's like to live in the life of someone with dementia. And so we'll be targeting legislators, we'll be targeting state agency leaders, we'll be targeting first responders, we'll be targeting family caregivers, just really providing that hands-on perspective so that we can increase that outreach and engagement. And then we'll continue to provide cultural competency training. It is so important that our stakeholders are culturally competent in the work that they're doing. And so we want to make sure that we provide that as a resource through the BOLD program. As Denise shared, we will be enhancing our state plan. We are very close to finalizing what that draft looks like to get final approval. And just a key element of that, again, is transitions of care. We have heard from so many family caregivers that transitioning through the cascade of receiving a diagnosis to receiving clinical support is challenging. And so we are very much looking forward to focusing on that transition of care plan and providing where we know there are resources available, providing those resources and increasing awareness of those resources. We will be expanding our project for the social determinants of health work. And then two, age and dementia friendly communities. In Mississippi, we currently do not have any recognized dementia-friendly communities. We do have 5 age-friendly communities that are recognized through AARP. I serve as the state lead for the Age-Friendly Public Health Systems Initiative through Trust for America's Health. And so in tandem with our age-friendly work, we have now established a collaboration to where we're going to have both age and dementia-friendly communities established in Mississippi. We have developed an integrated work plan, bringing those key partners together and looking at those shared livability domains. And so we're really excited to find a way to create this built environment in Mississippi for this Alzheimer's disease and related dementias work. And so through our age-friendly public health work, through our BOLD work, and through just a lot of our stakeholders, we're trying to create this opportunity for just continued engagement and continued progress to really support the needs of our caregivers and those diagnosed with the disease. Next slide. So key takeaways, and I will share this with Denise.
Thank you. Just a few key takeaways, and we touched on this earlier. I think that it's important to continuously be recruiting new stakeholders or contributors to be involved in the Alzheimer's State Plan. We're always thinking about what other organizations we need or want to be involved who are providing care and support services to those living with Alzheimer's and dementia. And then it's really important to find ways to keep those volunteers engaged. We are so appreciative to have the group with us that we do have, because they all, well, most all of them have full-time jobs, and they work with us to really advance the goals and objectives of the state plan. So I think the Alzheimer's Summit annually and really celebrating the accomplishments of the goal groups is really important. And then staying in touch with each of the members and letting them know that their voice is important is also a key way to retain your volunteers. Tina?
Sure. And then also too, looking at diverse communities, we were able this year to visit. We have one federally recognized tribe in Mississippi, the Mississippi Band of Choctaw Indians, and we were actually able to, a couple of months ago, visit with them and share the roadmap for the Indian country and just provide the opportunity for them to become more involved in our work. And so we understand that they have a different process for involvement, but we at least wanted to introduce the opportunity. And so we're hoping in year 3 to have more continued discussions with that team. And then lastly, I always say the goal is to be complementary and not competitive. There is enough space for all of us to do this work. And so we just try to complement each other, support each other, and fill in the gaps as we need to provide the support that we need. And I definitely wanted to acknowledge, there was a comment that Michelle made. I totally agree. We definitely want to use language such as individuals living with disease and not individuals suffering from the disease. Absolutely, because we understand that this is something near and dear, and how we frame what we do is very important. So as we engage individuals living with the disease and invite them to be a part of our work, that is very important. There was a question also, Denise, about the development of our caregiver map. And if you could share sort of the scan that we conducted for the information for the map and how we plan to utilize that map.
Definitely, I can give you a little bit more detail. The goal group, the caregiver support goal group, has spent a lot of time identifying services that would be important for families of those living with Alzheimer's and dementia to be aware of in our state. And we actually had created a subcommittee to focus on collecting the information to be populated on the map. But we're looking to have the map be an online interactive map where someone could go and click on a link to identify any respite care programs across the state or caregiver support groups across the state. They will also be able to search based on a specific county to see what services are available in that location for older adults and those living with Alzheimer's and dementia. And so we're looking to make it user-friendly, of course. It's going to be color-coded, and we're very excited to be able to implement it and then spread the word and raise awareness about the tool. So that is a key goal of our year 3 program.
Next slide, Elma. So these are several of the resources that were discussed today during our presentation. I know there were a few comments, Denise, about accessing the Mind Minute newsletter and being able to receive a copy of that. And so there's a link there on one of our newsletters that we did for dementia medications. And I think the request was to be a part of ongoing distribution. And so we may have to receive a way to receive your email addresses to be able to add to that distribution list. And I believe there was one person who I believe Michelle just raised her hand, I believe. Let's see, Elma, do you see if there was a raised hand by Michelle?
Yeah, I'm looking, but I don't see any raised hands.
Okay.
I see that Michelle shared a link to positive language related to dementia. So thank you, Michelle, for sharing that.
And also too, through our age-friendly work, we've been doing a lot of work on reframing aging and using certain terms so that there's more positive language, even related to older adults. So that's definitely always something for us to keep in the forefront. Absolutely. I think sometimes we're very guilty of using former language, but it's great to very much be reminded of that. Next slide, Elma. Perfect. So we have a couple of video clips that we just want to briefly share. One is from our Brain Health and Equity Symposium from a Latino Hispanic perspective. And then if we have time, we'll share a clip from the awareness campaign. But Denise?
Actually, Maya, can you please share the video, the first video?
Yeah, Maya's working on it.
Thank you very much.
Thank you. Could everybody hear that?
We're not able to hear it.
Okay.
Lifestyle barriers. I'm still personally looking for someone to schedule
Maya, maybe we can, we apologize for this technical difficulty. Maybe we can leave the video links, and when we share the slides, people could view them. I wish we could, it were easier.
Certainly, we can do that. And just to let you, can you hear me? Just to let you know that that's a clip of a physician assistant here in the Jackson area, and he cares for a number of Latino and Hispanic patients. And he gave a presentation as part of the Brain Health and Equity Symposium that we hosted that really shared some in-depth information about some of the challenges that Latinos face in our state. It was very eye-opening. And so I think you'll enjoy watching the video clip at a later time.
Maybe we can try it again. I believe someone was saying that they could hear it. I'm going to let Maya mute herself and run the video. Would you mind trying, Maya? One more time before we go on to the Q&A.
Things that I can share with anybody is the barriers that we have here in the United States, especially Mississippi, with language and lifestyle barriers. I'm still personally looking for someone to schedule my patients here at NEA and at St. Dominic's so that they have access to me. And a lot of the times we see child translators, but some of the medical problems that we have are not age appropriate for a child to be translated. And especially when it comes to mental health, a lot of the families have the shame that they're coming in for depression, or shame that they're coming in because they're noticing something wrong with their brain. And the only source of translation for them is speak with a provider to a child. And for a lot of that, they just choose not to be treated for those reasons. And when we have translation services, I've used some of them in the past before. Those translations, sometimes there's not 100% clear-cut communication because the interpreter takes it upon themselves to summarize what the person is trying to say versus what exactly they're trying to express. And so one of the things that we have as a barrier is understanding why anybody migrated to Mississippi or anybody migrated to the United States. And a lot of the times they're coming from places where crime and poverty, where they're trying to provide for the loved ones back home, and the type of work that they do. All of those are key components and factors to understand what it is that we need to provide for this community. When I see somebody who's a laborer, I always worry about their orthopedic problems. When I see that somebody's here escaping crime and poverty, I always worry about mental health issues such as depression. Were they human trafficked here? Is there other underlying conditions? So those are the key questions that I always ask. And with the poverty comes, did they ever get vaccinated? Did they ever get good nutrition? Is there other physical problems that we need to address because of where they're coming from? Was there lack of anything that they basic needs that they needed? And addressing those, because those are all the building blocks towards bad mental health in later years. And I always believe that the prevention of all these things will always be more cost effective for any household and anybody out there. But just simply understanding where and why these folks are coming here is an important track, because not everybody's coming from major city or metropolitan areas. They're coming from poor farms where there's no work, and so they're willing to take on any work themselves to death, and work 10, 12-hour days, multiple days in a row, and wear themselves out. So they don't look age appropriate. They look older than what they appear. I see several 30-year-olds and I'm looking at them. I'm like, I'm not trying to say you look rough, but you look like you've aged and you're actually 50, 60 years old, and their body reflects it as well. One of the things that I challenge anybody who sees these Hispanic folks is to ask themselves, please tell me about yourself. Where did you come from so that I can understand how to take care of you?
Thank you, Elma. And Kina, I'll turn it over to you to introduce the next video if we have time.
Sure. I'm not sure if we'll have time because I know Elma wanted to save time
Yes.
for Q&A, but so the Know Where Alzheimer's Has campaign, it's a national campaign that was developed by the Alzheimer's Association. So some of you may be familiar with it, but if not, there'll be a link for you all to be able to share. But just as a reflection moment from what Gabe shared, we learned quite a bit as it relates to our Hispanic Latino community about being more culturally competent. There was a piece that probably wasn't in this clip where we talked about diet and nutrition and how for the Hispanic Latino population, certain meals are a part of their, just a part of their culture and what's important to them. And so as we discuss diet, nutrition, it may be insensitive to suggest that they eliminate certain foods from their diet. And so finding other ways to be supportive for them in improving their health is also very important. And so just learning again from these various diverse communities, how best we can support the whole person as we address Alzheimer's disease and related dementias. Absolutely. And so now I'll turn it to Elma. Wow,
This was great time spent together. Kina and Denise, thank you so much for sharing all of this. This was a great presentation, and let's just give them a round of virtual applause, everybody, please, here in reactions. Let's put our hands together. Amazing work in Mississippi, and thank you to all of you watching us and listening, hearing, and you've stuck here through the end. Most of you have stayed. If you're maybe at the beginning, we had some issues with the poll. The poll is now ready, so I'm just going to quickly run it. If you could please just answer one very brief question. Again, it's to give us an idea of who is here with us today. How many public health agencies we have, bold and not bold, etc. So I'll just give you 15, 20 seconds. Thank you. So we have about 33, 1/3 of you are bold public health agencies. Great turnout, bold team. And 30% are non-bold public health agencies from around the country that have joined us today. 20% are community organizations and service providers, about approximately. The numbers keep coming in, but it's a very good idea of who was here with us today. Thank you so much. So as promised, we had reserved the remainder of our time together, 15 minutes. We wish we could have had more just for open discussion. Remember those questions that Denise and Kina were asking earlier? Feel free to raise your hand. We can unmute you. If you want to add anything about the coalition in your state, or how you use data, what data sources you use, or what other questions might you have for Denise and Kina that you could get ideas from for your own work in your state. So I see one hand is up. Michael Ellenbogen. I'm going to unmute you. Would you?
Hi, thank you so much for this presentation today. I have two comments. First of all, with the questionnaire you just sent out, I saw you had caregivers in there, but you didn't seem to include people who are living with the disease, which I would think is pretty important. I have to tell you, I'm living with dementia, and I feel like a secondhand citizen because it's always the caregiver. If this was something to do with cancer, would we be talking about their caregiver, or would we be talking about the person who's living with the cancer? My second comment is, I served on the Pennsylvania State Planning Committee. I was appointed by the governor to work on the State Planning Committee for dementia. And when I was in Pennsylvania, it worked out great. I moved to Maryland, and they themselves also did not have a person living with dementia. I believe you folks who are working on state plans mean good, but you're failing the people who are living with this disease if you cannot set the example to include the people with the disease. I don't understand how it's even possible to run a committee when you do not include the people who are actually living with the disease. And I don't know who's responsible for doing that. I kind of, in my opinion, I think it's the Alzheimer's Association who should be at partial fault to this, because they're the ones who are representing people with dementia in the United States, and they're involved in all these committees across the states, yet they're not including the people. So I would question that you folks look back and see what's wrong here, because we have to include the people who are affected by this and impacted by this. Thank you.
Good. Thank you, Mr. Ellenbogen. I am sorry for that oversight that we missed that in the poll. You're right. And I took a note in the future installments of the series. I will make sure that that is added to the poll. You're absolutely right. People living with dementia should be at the top of the list always, and really including in our coalitions and our stakeholders group. Denise and Kina, would you like to add any comments?
Yes, I would like to comment. And Michael, I believe you raised an excellent point. And as I mentioned, we have had members of the goal groups over the years who were living with Alzheimer's or dementia. Unfortunately, right now we do not, but we are in the process of seeking to recruit new members, because I agree it is critical to hear from those who are experiencing what it's like to be living with Alzheimer's or another type of dementia. So thank you for bringing that to the forefront, because you're right, it is so very important.
Thank you. Is there any other questions, any other comments that, or anything you would like to share about your work for those of you in the audience from public health agencies? Anything else you would like to hear about or to share with the rest? There's a question from Dr. James Wheaton. We're a local in the chat. We're a local health department and are preparing to apply to the next round of funding for the BOLD grant. Could you talk about the scale of the funding amount for the BOLD grant? And anything you would have liked to change after the first round of funding? I don't know if we have anybody here. I don't know if we have anybody here in the room from CDC, perhaps, who could speak to this question. I see that Heidi Holt maybe joined us. Who could maybe answer this question. I'm going to put it again in the chat. If you could answer this, please feel free to unmute yourself. And while we get that answer, maybe we can answer the next one from Emma Smith.
So Elma, can you hear me, Elma?
Yeah.
Real quick, before, if Heidi is able to unmute, great, but I'm not sure if the person who asked that question is familiar with the forecast that has actually been publicized on both the CDC page as well as grants.gov, but CDC has released a forecast related to the next round of funding and I can try to put that in the chat as well, but I believe Heidi unmuted herself. Hey, Heidi.
I did. Sorry, I didn't hear my name. I logged in after my name was said, so I didn't realize that was for me. So I do apologize for not being able to join us earlier. I can address this, and it's not going to be an answer I think anybody would like to see, but right now, the only information, and Kina, you are right, the only information we do have public about the new round of funding for the BOLD programs is on grants.gov in the forecast. And the number of that grant is DP 23-0010. And you can search on that and find out the information. But at this time, the level of funding, the scale of funding, and any questions are unable to be answered at this time. So I would just encourage people to look at the previous funding opportunities that are out there, any information on our webpage. And once it is published, we'll be able to answer all the questions via the FAQ at the mailbox for the NOFO.
Thank you, Kina, for that link. There's a question in the chat from Emma Smith. Do you engage with research and good practice from around the world to help you with your work?
So I'll start the answer to that question, and then I'll let Denise pick up. So that answer is absolutely yes. We actually use, I didn't share it in terms of data, but we actually use information from the World Health Organization, both for our age and dementia friendly work, but also looking at Healthy People 2030 and just some of the ways that we really compare our work in not only just Mississippi, but the US. Even though the BOLD grant is not a research-based cooperative agreement, we do understand there are elements of research that impact the work that we do. And so absolutely, we do look at other sources of information, both domestic and international, to do this work. And then as it relates to clinical trials and research related to the clinical component, Denise can certainly share that, because there are a number of studies that have been conducted and continue to be for this work. So for the BOLD program, yes, we actually do utilize research to better understand our efforts, especially from a public health upstream approach. But from the clinical side, I'll let Denise share as well from a research clinical perspective what's being used.
Sure, and I will echo what Kina just shared, that we strive to be very data-driven with our efforts through the Alzheimer's State Plan. And also a key goal of the research goal group, which I lead, is to stay on top of new research, both in the area of social determinants of health for Alzheimer's disease and dementia, but also as it pertains to new treatments on the horizon. And so I did see a question in the chat about so much research going on, but are we close to a cure? Many of you may be familiar with the announcements that have come out over the past year. The first one about Aduhelm or aducanumab, and the latest one about lecanemab, which are both monoclonal antibodies. While there's still work to be done on those treatments, the monoclonal antibodies are very promising. They are designed to help to remove the beta amyloid plaques from the brains of those with Alzheimer's disease. And so that is looking promising. The work of the Mind Center is focused on identifying ways to prevent Alzheimer's disease and dementia. And so we actually have 21 active studies underway that are funded by the National Institutes of Health. And one that we're in the process of launching is in partnership with Mayo Clinic, called the Mind Center Mayo Clinic Study of Aging. And it's a long-term study that's going to look at not only how we can help to prevent Alzheimer's and dementia as people age, but also how we can help people live healthy lives and maintain their gait and function as they age. And so that's a really exciting study as well. And wouldn't it be wonderful if we could prevent these diseases in the first place? So that's certainly one of our key goals.
And the other place that we were able to introduce some new research is our continuing medical education event. Several of our providers, and Denise May was going to share this as well, but several of our clinical providers, when they shared their presentations, they were able to use research-based evidence to support a lot of the recommendations for addressing, whether it's through a diet, whether it's through prevention activities for physical activity, et cetera. So research was utilized to provide those best practice approaches. And so I think it's a continuous learning opportunity. I think we would all agree we'd love to have a cure for this condition. I think one of the things we frequently combat is that people assume that dementia and Alzheimer's and living with the disease is a normal part of aging, and it is not. And so I think we continue to have a lot of work to do to better understand the disease and how we can hope to create a cure for it.
Thank you. Thank you, Kina and Denise. We have just about 3 minutes left, unfortunately. As I said earlier, we could go on for a while. It's been a great conversation, a lot of questions in the chat. I also know that you too had some questions for the audience as well. And I was wondering if you would like to maybe select one of those questions and ask them from the attendees that are still here in the time we have together.
Denise, did you want to ask one, or I can ask a final one?
Go ahead.
Oh, sure. Well, I was just going to ask for those of us in public health doing this work. Public health, at least in Mississippi, again, was not initially a key stakeholder in addressing Alzheimer's disease and related dementias. But through my peers, I've heard from several other states where public health is definitely actively involved. And so I'd just love to hear from other bold grantees or caregivers otherwise. What are some ideas or strategies? I know that Michael shared a great perspective about not just including caregivers, but including those living with the disease and ensuring that they're respected in that way to gain a better understanding. But are there other recommendations that anyone has as it relates to this work, or more creative ways or more innovative ways that we can really address these needs? And so if anyone has ideas, please share in the chat. We'd love to learn more and we'd love to do more. So any ideas or any challenges?
You can unmute yourself as well, or raise your hand if you would like to speak.
I think Michael just raised his hand again, so we definitely welcome Michael for you to share for sure.
I think what all the state plans are doing is fantastic as far as what they're doing. But I think what is missing is, what I would like to see is that all the state plans meet maybe once a year together and to discuss what they're all doing within their own state, and maybe present what works in their state and what's failed in their state. And there could be some real benefits from doing that. I understand every state's different and what the needs are, but I think there's a lot that can be learned if you folks sat at a round table, maybe have 2 or 3 key people from each state to work together once a year at a meeting. And I just think there could be so much benefits from something like that.
What a great idea. Like almost like a national public health summit.
And include NAPA,
yeah.
include NAPA,
Yeah.
because while they're doing the national plan, I also think they're not doing enough to be involved with the state plan. So I think all of you together sitting at the round table would be fantastic.
That's great. And actually, Mr. Ellenbogen, thank you. That's a great comment, and which brings me back and kind of to help us wrap up here to the original goal of this series. Even for a small group, we're really hoping to build a community of practice of public health agencies within the BOLD program and beyond to do exactly that. So we are grateful to all of you who are able to join us today. All of the information shared today, the slides and the resources in the chat will be shared with you afterwards. If you're available tomorrow, we actually have another webinar. This one will focus and center on the topic of stigma and how, related to dementia, how it affects the people living with dementia and their families and caregivers. So we hope that you'll be able to join us. Again, any questions, let us know, or else feel free to reach out to Denise or Kina. And Maya, if you don't mind, please look in the chat to give us feedback. We will pop in a brief survey, link to a survey. Tell us how we did. This is the first time we did this format. So any way we can improve would be greatly appreciated. Any final words, Kina and Denise?
No, just always great to meet with my other BOLD colleagues. We've seen each other quite a few times, but obviously not enough for those of us who've participated in our Centers of Excellence conferences. But I would definitely welcome an opportunity for all of the state plans to sort of be in a hub perspective so that we can see what's happening in other states and learn. And sometimes we can save resources by not reinventing the wheel or making a similar mistake and just learning from others. So I definitely think this peer space that has been provided is great. It definitely helps us to strengthen what we're doing, but also learn from others who are also doing a phenomenal job.
I would agree. I think it's an excellent idea, not only to get the individuals who are involved in the state planning efforts in each state together, but also I like the suggestion of involving NAPA as well, because I think we can learn from what's being done nationally, and they can learn and provide guidance about what we're doing at the state level as well. So I appreciate the opportunity to have spent this time with y'all.
Yep. And lastly, just chronic disease. If we could have more chronic disease leadership at the table as we really look at treating the whole person and not just the disease, and having our chronic friends also at the table.
Thank you. Thank you so much to our presenters, to all of you who stayed to the end. And maybe you decide you would like to present your work. Come back to this space again in 2 months. Let me know. Email us, visit our website, bolddementiacaregiving.org. Send the contact email and let us know. We would love to feature your work as well. Thank you, Mississippi team. Thank you, everyone. Have a great day.